In this presentation, we are going to discuss all the pathologies of the nervous system. Okay, so let's look at the neurological dysfunctions. There can be some due to local effects which are related to the specific area of the brain or the spinal cord. For example, paresis, that is a weakness or paralysis of the right arm from damage to a section of the left frontal lobe. So if only a part of the frontal lobe is affected, you might have just the complaint of a weakness in the right arm or a paralysis of the right arm. If any area in the occipital lobe is affected, then there is a chance that the individual will complain of loss of vision. Okay, that is like the local effects that you can see. Then there are some supratentorial and infratentorial lesions. So there is a tentorium cerebelli. It is around in the brain stem, and it is kind of like a thin membrane kind of a structure, and it differentiates like it there are structures above the cerebelli and below the membrane. So above the, if there is any problem or damage to the structures above that membrane, then it can lead to the numbness of the hand. And if there is any problem below the tentorium cerebelli, then there are small lesions and they can cause serious effects, because below the tentorium cerebelli is the brainstem area. Okay, and we all know that brainstem controls all the major functions of the body, like breathing, heart rate and all that. So everything can be affected by just a small lesion in that area. Okay, now again, neurological dysfunction can be related to the left and right hemispheres. If there is a damage to the left side, then there can be a loss of logical thinkings or the analytical skills. If there is a damage to the right side, then it is said that the person loses the music and art appreciation. So how we going to assess if there is any nervous, if the patient is affected? The most common way we assess an individual is by checking the Glasgow Coma Scale. So we ask, right, whenever there is an accident, if you have been in a road traffic accident, the first thing that the EMTs ask is the name of the person, where are they located, and what is the date and the time. So they are trying to see if the patient is oriented or not. They try to look if if their eyes are open or not. They try to see if the person is moving their hands and legs or not, and accordingly if they grade, right, the Glasgow Coma Scale, there is a grading. So if the eyes are opened spontaneously, like they are open without telling them to, then the score is of a 4. If they open when they are asked to, like you tell the person please open your eyes and they open their eyes, then the score is of 3. If there is if you have to, to pain means, they generally, what do they do is they try to press on the sternum, and if the patient opens eyes on that response, then the score is of 2. And if even after doing that painful that stimulus, if they still do not open the eyes, then the score is of 1. Then they try to check for the verbal response. They ask the time, place and person. If they are able to answer them, then the score is of 5. If they can say the name but they do not know what time it is, or they are like confused where they are, then the score is of 4. If they say inappropriate like words, like which are not, like they get angry and something like that, then the score is of 3. If they make incomprehensible sounds, like um, they speak something but they are not proper words, they are not logical words, so then the score is of 2. And if there is no response, they cannot speak anything, then the score is of 1. Then they try to tell the individuals, the affected individual, to move their right hand, move their left hand. If they can do it, then the score is of 6. If they do not do it, then what they do is they try to again cause a stimuli, like they try to cause a stimulus in one of the hands, and if they can move that hand, that means they can localize the pain, right, and the score is of 5. If they move their flex their arms or legs in response to the stimulus, it is a score of 4. If the whole position of the body is an abnormal flexion, the decorticate decerebrate position, then there is a score of 3. If there is abnormal extension, then the score is of 2. And if there is no response to the in spite of all the stimulus, then the score is of 1. Okay, that is how they assess the general function, or the what is the status of the level of consciousness of the individual. Okay, from that we have to discuss that what is the vegetative state. So what happens is there is a loss of awareness and mental capabilities. Okay, because of the diffuse injury to the brain, the person is not aware where he or she is. They cannot think, they cannot say, they cannot do anything. Okay, that is a vegetative state. Okay, their heart is beating, they are breathing, but they cannot say anything, they cannot think anything. So basically the brainstem, everything is working, but brainstem functions are working, but rest of the brain is not working, right? So that leads to a vegetative state. Then there is a state called as a locked in syndrome. Now what happens in a locked in syndrome is the individual is aware. It's if you guys ever watched House MD, there was a very fascinating case they showed on it of a locked in syndrome. So what happens is the individual is totally aware and is capable of thinking and everything, but the individual is paralyzed, and so he or she cannot express what they are saying or what they are thinking. Okay, they cannot communicate with the other people. Some people, it is said that some people can communicate by moving their eyes. Like if they want to say yes, they blink once. If they want to say no, they blink twice. They can do stuff like that. And if we are looking at the recent advances, because their brain is still working, so somehow the computer is developed which is attached to their brain, and so when they are thinking, that command can be, the signals can be taken up by the computer, and they can communicate via the use of that computer. Okay, um, then there is a condition where the individual is said to be brain dead. That means there is nothing is working. Okay, it's the last stage. Like there is not, the person is not even breathing on its own, the heart of the person is not beating, and person is definitely not communicating with the outside world, or there is nothing, no pain, no stimulus to the pain, nothing is going on. That is a brain dead person. And a brain dead person is only alive because they are hooked up to the machines. Okay, the ventilators and all the other heart beating machines, then only they can be alive. Otherwise, as soon as you remove all those machines, all those aids, the person will stop breathing and will stop living. Okay, now coming to the there are other dysfunctions, which is motor dysfunction. What happens in the motor dysfunction is there is a paralysis which can happen due to the motor neuron damage. Remember we discussed the motor neurons, the upper motor and the lower motor neurons. The two postures that we were talking about, there is a decorticate posture. What happens in decorticate is there is a rigid flexion in the upper limbs, adducted arms and internal rotation of the hands, extended lower limbs. Then it is a clear cut indication that the individual has a cerebral hemisphere damage. The other posturing is a decerebrate posturing, where everything is extended, head and body is arched, and that is a clear cut indication of a brainstem lesion. Okay, so I can we can look up for the image for decorticate, where both the hands are like folded on the chest, and the legs and everything is extended, they are open, right? That's a decerebrate. Decorticate. And a decerebrate is where everything is like the person is lying with the hands extended open, the head and body is arched, like the head and the body is kind of curved. Okay, then that's a indication that there is some injury, or the lesion is in the brainstem. Okay, those are the motor dysfunction. The sensory deficit can be due to touch, pain, temperature, vision, hearing, taste and smell. These are all the senses which are unique to all the all the animals and all those who can so touch, pain, temperature, vision, hearing, taste and smell are the sensory functions. Damage to specific part of the parietal lobe can lead to a specific loss of the sensation, as I said, right? So if there is any damage to the olfactory area, then the smell can be affected. If there is a damage to the Wernicke's or Broca's area, right, then the speech or the listening capacity is affected. If there is any damage to parietal lobe area, the sensory area, remember we saw in the physiology slides, then there can be changes in the taste and temperature and touch. These all, you can, individual can lose the capacity to feel all this. Okay. Now visual loss, whenever you think about visual, think about optic nerves, think about the optic chiasma formed by the optic nerves and the occipital lobe, right? So the visual loss optic chiasma has fibers of medial and lateral visual fields. Depending on site of damage, visual loss can occur in lateral or medial field of eyes. I have not included the detailed optic chiasma because it can become very complicated and I don't want to confuse you all. So let's just keep it to this, that the visual field is divided into medial and lateral fields, and depending on which fiber is injured, that area or like that field of vision, the medial or the lateral field of vision, can be lost by the individual. Okay. Language disorders are aphasia, inability to comprehend or express language, expressive aphasia or motor aphasia, which means that the individual has an impaired ability to speak or write fluently, which means that the Broca's area is affected. Then there is receptive or sensory aphasia, where there is a damage to the Wernicke area, so the individual cannot read or understand the words. Okay. And there is a fluent meaningless speech, whatever they will speak, they will speak a lot of words, but they are not logical. Okay. Global aphasia means there is both expressive and receptive, both everything is affected. Okay. Broca and Wernicke, both areas are affected. Okay. So Broca's area, you cannot speak. Wernicke's area, you cannot even understand what you are being spoken to. Okay. The other language disorders that we can think about is a dysarthria, where the words cannot be articulate, the person cannot make the word. Okay. Then there is agraphia, where the person cannot write, the writing capacity is lost. There is alexia, where the reading capacity is impaired. Then there is agnosia, where there is loss of recognition or association. Example, visual agnosia, that is the individual cannot recognize the object, that is agnosia. Okay. Like if the person has a visual agnosia, then they can like see, like if you give them a pen, they can see that it's a pen, but they cannot say that it's a pen, right? They cannot recognize that it's a pen, they will say that it's a tubular object. Okay. And then there is one nominal aphasia, which we can see commonly. What happens in nominal aphasia is the person will hold the pen and they will say, okay, this is the tubular object, you use it to write and everything, only the word pen will not come to their mind. Okay. That's nominal aphasia, just the name is missing from the memory. Okay. It's not that they don't know, just it is missing from their memory. Okay, the next disorders we are talking about is seizures. What are seizures? They are the spontaneous excessive discharge of neurons in the brain. There will be involuntary repetitive movements or abnormal sensations which are focal or general. The causes will be inflammation, hypoxia or bleeding in the brain. Okay, any of these conditions can lead to seizures in the individual. There can be an increased intracranial pressure in the individual. Why does that happen? You saw the circulation of CSF in the brain and around the brain and in the skull, so it's a limited space, right? Now if by chance either the volume of the CSF increases or the space in which the CSF circulates decreases due to any such condition, then the intracranial pressure is going to increase, right? So limited space in the skull cavity, there is an increase in the blood or fluid, or tumor is there in the space which is decreasing the space, right? Or inflammation, that is also decreasing the space. All these things can lead to an increased intracranial pressure in an individual. What are the signs and symptoms? The individual will present with severe headache, vomiting, and papilloedema. Okay, papilloedema is if you look at their eyes, the papilla of the eyes, there will be edema in it. Okay, there will be swelling around the eyes. Then continuous increased intracranial pressure, you understand, right? Because why is the pressure increased? Because something is going wrong around the brain. So continuously increased intracranial pressure can lead to cerebral ischemia, because CSF transports oxygen, transports nutrients, right? Now if the CSF cannot reach to certain parts of the brain, there is going to be ischemia because there is no oxygen. Okay, and blood supply can also be decreased because of any such reasons, because the circulation is not free, not happening. That leads to Cushing's reflex, where there is an increased arterial supply to the brain because of the systemic vasoconstriction. Then that can lead to an increased systemic blood pressure, which forces more blood to the brain. Other reactions are slowing of heart rate and respiration. So what this Cushing's reflex is, what happens is, due to continuous increased intracranial pressure, there can be a condition called cerebral ischemia. The blood supply to the brain can be decreased. Now as soon as the blood supply to the brain is decreased, the overall body tries to compensate for it. Okay, how does it compensate for it? So all the other organs of the body will say, we don't need the blood, give it all to the brain. So the vessels in all the other parts of the body will constrict. That will cause an increase in the blood pressure in the body. Okay, the systemic blood pressure will increase. That is the Cushing's reflex. The systemic blood pressure is increasing because there is ischemic changes into the brain, which is happening because of the increased intracranial pressure. Okay, other things can also happen. Other reactions like slowing of the heart rate and respirations can also happen. As still the intracranial pressure continues to rise, the individual can have a chain stroke respiration. What is chain stroke respiration? Is a typical breathing pattern where apnea is there and increasing and decreasing respirations. So what happens is, we all breathe in a definite pattern, in a definite volume, right? It's like everything is normal. But in chain stroke respiration, the individual will have apnea, not breathing, then suddenly a deep breath, then suddenly release it out, then the shallow breath, release it out, like that. So it's not constantly deep breathe or constantly shallow breathe. Okay, it's like up and down. So that's a chain stroke respiration. Again, the intracranial pressure continues to rise, and then it can lead to the pupils blowing out. Okay, once the pupils start blowing out, that means that the intracranial pressure is so much that the person is not going to, the brain is not going to survive so much of an increased pressure. Okay, and then when we say pupils are blown out, most probably the patient individual is going to lose the cerebral activities, is going to die. Okay, the brain is going to die. The increased intracranial pressure is generally used when the CSF pressure is greater than 20 mmHg. That's the parameter. Okay, what are the tests that you do to determine it? CT can be done, MRI can be done, cerebral angiography can be done, Doppler ultrasonography can be done, and EEG can be done. Now, coming from the increased intracranial pressure, one of the common complications is herniation. Because the pressure is increasing in the brain, some part of the brain can herniate. Okay, so the most common herniations I have tried to show here. This is the uncle that is herniating. This is the central portion of the brain that is herniating, coming down. This is the cingulate, like this is how the brain is, right? And this is the both the cerebral hemispheres. So this one cerebral hemisphere trying to go into the other one, that's the cingulate. Transcalvarial, well, here you can see the cerebral cortex is trying to come out of the skull. There can be those are all supratentorial. Now infratentorial is here below the brainstem, and what can happen is the brainstem is trying to grow up. Okay, and then there is a tonsillar which is trying to come down. Tonsillar is the brainstem that is trying to come down from the foramen magnum. Okay, we were just discussing the supratentorial infratentorial regions, remember? So here this is the image which is showing you. This is the tentorium cerebelli. What happens is it is differentiating these cerebral cortexes from the cerebellum and the brainstem. Okay, so this is a tentorium cerebelli. All the lesions happening above it, they are all supratentorial. All the lesions happening below it are infratentorial. Okay, brain tumors. So coming to the next pathology is about the brain tumors. What is the most common cause of increased intracranial pressure is space occupying lesion, a tumor. Okay, so what are the primary tumors of the brain? We saw the cells of the primary cells of the brain, right? So there were the astrocytes. The tumor arising from that is astrocytoma. Then the meninges covering the brain, the tumor arising in those meninges is called as meningioma. And then we also have adenoma, which is a tumor in the pituitary gland. Okay, primary, they generally do not metastasize outside brain but can be at multiple sites in the brain. So what happens is, generally in a brain tumor, when they are primary, they will not go out of the brain cavity, because there is so less communication, right, between the brain and the rest of the body. So there is not much space for the tumor to go out and communicate with the rest of the body. So what does it do? It does not metastasize to distant part. It goes and forms small deposits in many different parts of the brain. So that is a very peculiarity of the primary brain tumor. If it is a very well defined tumor in one area, you are going to find more than one areas in that brain. Okay, now there can be secondary brain tumors also, which are generally from the metastasis, and the metastasis are generally occur from the breast and the lungs. Okay, how do you diagnose the brain tumors? By MRI. Pathophysiology can cause compression, increase in intracranial pressure. They can also cause herniation. Etiology is common in younger children. Prenatal parental exposure to carcinogens, it is common in the children because something has been exposed, some injurious substance has been exposed during their conception period. The signs and symptoms are generally morning headache, vomiting, lethargy, irritability, seizures, facial paralysis, visual problems, and the treatment generally involves surgery, chemotherapy, and radiation. Okay, this is an image showing all the common types of brain tumors. These are the primary brain tumors. What are the names of the primary tumors? Is the meningioma, glioblastoma. Glioblastoma is the grade 4 and most commonly seen primary brain tumor. Then astrocytoma and oligodendroglioma. Okay, remember the cells of the brain: astrocytes, oligodendrocytes. This is that. Okay, there can also be metastasis. The breast and lung metastasis are generally happening here. There can be lymphoma metastasis and there can be melanoma metastasis. Okay, this is just an image to show how the brain tumors can be seen. Okay, this is like the normal area, and this you can see the tumor over here, that is the glioblastoma multiforme. That is how you see in the CT. This is a cross section of the brain, and this is a normal looking area of the brain, and this is the tumor. You can see all necrosis and everything. So that's a tumor. Okay, that was all about the tumors. Now we are coming to the vascular disorders, or the disorders which are happening into the nervous system because of blood supply problems. Okay, so what are those disorders? There can be hemorrhagic or ischemic, excessive blood supply, less blood supply, right? TIA, that is transient ischemic attack. There can be cerebrovascular accident, that is called as stroke, most commonly seen, right? And there can be aneurysm, dilatation of the blood vessel, right? First we are going to discuss the transient ischemic attack. So transient ischemic attack is the same as that happens in the heart. What happens is there is an attack of ischemia, but again it goes away and the portion starts functioning. Only that little area has died. In same thing happens with heart also. There are like there will be a tiny area of the cardiac muscle where there was no oxygen supply, and because of that tiny portion of the cardiac muscle dies, but still the rest of the heart continues to pump blood. So that is a transient ischemic attack. So it happens, and there are signs and symptoms for a short period of time, and then it goes away. Okay. So let's look how it does in the CNS. There is a temporary localized reduction of blood flow in the brain, and recovery happens in the 24 hours. It may occur as a single episode, or it can appear as serial episodes. The pathophysiology can be a partial occlusion of the artery due to atherosclerosis, or due to a small embolus, or due to a spasm of the vessel, or due to the loss of autoregulation. There can be a sign for stroke in some cases. So some cases may show the signs of the stroke. Okay. What are the signs and symptoms? There are short episodes of impaired function like muscle weakness in an arm or leg, visual disturbances, etc., depending on site of ischemia. It should be investigated properly in all the cases. Okay. The next vascular disorder that we are discussing is cerebrovascular accident, also called as stroke. It is generally seen in individuals who are greater than 65 years old. They are the major causes of disability in older people. The pathophysiology is infarction of brain tissue from the lack of blood supply. 5 minutes of ischemia can lead to an irreversible nerve cell damage, leading to necrosis, which is surrounded by the inflammation, and that leads to liquefactive necrosis. Causes can be atherosclerosis, embolus, hemorrhage from the cerebral artery rupture. Diagnosis is generally done by MRI. The goal is in such stroke, in all the strokes, the goal is to limit the neuronal damage. Okay, to limit that blood supply, that area that is affected by the lack of blood supply, that area has to be limited. What are the etiology risk factors? If the individual is already having diabetes or hypertension or SLE, or elevated cholesterol levels like hyperlipidemia like conditions, if the individual has a history of transient ischemic attacks, increasing age, obstructive sleep apnea, or heart disease, they are more likely to have a stroke, to develop a stroke. Okay. Signs and symptoms depend on the location. Assessed on stroke scale, which checks motor, eye movements, consciousness, and speech. There can be a flaccid paralysis followed by spastic paralysis. The treatment generally, as we said, limit the injury, limit the ischemic area. So what do? You give clot busting agents, because ischemia is generally developed because there is clot somewhere. So you try to dissolve the clot by giving a TPA. But before giving TPA, you have to rule out that the stroke is not a hemorrhagic one. What do you mean by hemorrhagic one? That the stroke has not happened because of excessive bleeding. Okay, because of bleeding happening in some vessel that is ruptured or something, that can also lead to a stroke, right? And if you give TPA, then the TPA is supposed to not let the blood clot, right? So if you give TPA, it will keep on bleeding and the patient might die, right? So you have to rule out that the stroke is not hemorrhagic, it is due to an embolus or a clot somewhere, and so you can give a TPA, that is a tissue plasminogen activator. Reduce the cerebral edema by giving steroids, glucocorticoids. You rehabilitate the patient, try to maintain the vitals, and address the underlying concern, like why did the stroke happen? Was that a hypertension? Was it due to atherosclerosis? It sometimes is seen when an individual has forgotten to take his medication of hypertension. So the person will be having very high blood pressure, so you might need to control the blood pressure also. So treat the underlying cause. Okay. Fast is the approach that is used in the stroke patients. And how do you recognize that the person is an individual is having a stroke? There is a face drooping, arm weakness, or speech difficulty. Either you see an individual whose face is, one side of the face is dropping, or you see an individual who is complaining that one side of the arm is showing weakness, when there is pain and weakness. If the pain is radiating, then you might need to rule out heart condition, right? But if it is like a weakness, overall generalized weakness of the arm, then you might need to look into the stroke like condition. And if there is a difficulty in speaking, definitely call 911. So that's why fast time to call 911 if you see any of these symptoms. The next we are discussing is a cerebral aneurysm. So what is a cerebral aneurysm? The aneurysm is a localized dilatation of the artery. You know, artery is a tubular structure, right? So it is made up of different layers, the smooth muscle layers and the endothelial cell lining, and that is how the entire tubular structure of the artery is made. Now there can be a weakness in any of these layers, okay, either the endothelial cell layer or in the muscle cell layer. Anywhere there can be a weakness. When it is weak, it can the tubular structure can lose its tubular structure configuration, and it can turn into a balloon like structure. That is called as aneurysm. Okay, the dilatation, it can dilate and form a balloon like structure. Now cerebral are frequently multiple, occur at the site of bifurcation on the circle of Willis, and that is called as perianeurysm, and this circle of Willis is located at the optic chiasma. Okay, I'll show you in the next image. Due to hypertension, arterial wall may bulge, we just discussed, right, because of any problem with the structure of the artery, or if the artery is constantly under high pressure, it is going to bulge. It can be asymptomatic, and you unless increases in size and compresses or ruptures. Okay, generally aneurysms are asymptomatic. Nobody knows that they have a cerebral aneurysm until either the cerebral aneurysm ruptures or it compresses the surrounding objects. Then only, and there are symptoms like headaches or weakness or paralysis or something, or visual disturbances. Any complaints can develop, and then the person can undergo CT or MRI, and cerebral aneurysm can be recognized. Okay, there is if it ruptures, there is bleeding in the subarachnoid region leading to then increased intracranial pressure. Signs and symptoms can be visual disturbances as pressure up is coming on the optic chiasma, we just discussed, right, the perianeurysm. There can be headache also. Massive subarachnoid hemorrhage can lead to a blinding headache and seizures. Most commonly, if an individual comes and says that they had the worst headache of life, it's definitely going to be an aneurysm. Okay, an aneurysm rupture. And the most common cause, whenever they say worst headache of life, think subarachnoid hemorrhage. And when you are thinking subarachnoid hemorrhage, think either some artery has ruptured or some trauma or injury has happened, and think that the person is going to develop seizures next. Okay, death occurs shortly after the rupture. Why? If it is not been, this is a condition. A cerebral rupture of a cerebral aneurysm is a condition which has to be managed in seconds to minutes. Okay, it's not a condition which can be managed waiting for the investigations to come back. Okay, it is a condition in which there are only a few hours to save, because once the neurons die, you are not going to get them back. So this is a condition which has to be managed in a very speedy way. Treatment, if diagnosed early, can be treated surgically. If that rupture has not occurred, and if you diagnose that there is an aneurysm, you can treat it by clipping it off and tying off the aneurysm. Remember, it's a balloon, so you can clip off the balloon or you can tie it off. See over here, aneurysm. These are the different types of aneurysm. Okay, this is like a fusiform, the whole blood vessel is dilated. This is like only a portion of the wall is coming out. Okay, that's a secular, a sac like. And which is a common place, the circle of Willis. You can see over here, it is like kind of the main blood supply of the whole brain. Okay, so when we are talking aneurysm, we are mostly talking the blood supply of the whole brain. Okay, because this is the most common site. So blood supply to the brain, the aneurysm affected in the circle of Willis, and that can cause a lot of problems. Now that was about the vascular disorders. The next portion we are studying is the infections of the nervous system. What are the pathologic conditions when the brain is infected? There is meningitis when the meninges are inflamed. The brain tissue itself can have an abscess and lead to a condition called as encephalitis. The others can be due to the cause of rabies or a tetanus or a poliomyelitis. Then sometimes the infections are associated with syndromes like herpes zoster, shingles, which we call the virus infection, the post polio syndrome, or they can be race syndrome. Remember the reaction due to a drug intake, or it can be a GBS, Guillain-Barré syndrome. Okay, meningitis. Meningitis is the infection of the meninges, usually bacterial. They are spread by the direct extension from the infected organ, or they can be caused because there is an infection in the blood that is circulating. There are no focal symptoms as meninges are like totally covering the brain, right? So no focal symptoms are seen. There are pia and arachnoid layers. They are the ones which are becoming edematous. Dura is like the outermost. It's not affected so much as these two layers. There is an increase in the intracranial pressure. There can be a purulent exudate, and they cause the sulci to appear flat. So when you're looking at the brain, you see at the sulci and gyri, right? The up and down of the brain structure. But because of the inflammation and everything, you cannot see the down. Okay, everything is like this. No down going in the structure. Okay. The etiology is in children and young adult is the infection from the Neisseria bacteria. Meningitis, nasopharyngeal infection can Neisseria meningitis, nasopharyngeal infection can spread there. Also, if there is some infection in the nose or the pharynx, that can also go to the brain. The neonates, like newborns, most commonly seen is E. coli, which leads to meningitis, and it is generally associated with some neural tube defect. Also, when there is a premature rupture of membranes, those babies can develop meningitis. They can also, those who have had difficult deliveries can also develop meningitis. In young children, the infective organism is Haemophilus influenzae. Elderly and young children, the cause is Streptococcus pneumoniae. And sometimes, like in some conditions, you can see meningitis develops as a secondary to the sinus infection or the ear infection. Okay, secondary to the sinusitis or otitis. What are the signs and symptoms of meningitis? The individual can have a severe headache, a back pain, a nuchal rigidity, stiff neck. When you touch the neck of the person, it is very stiff. Okay, there are certain signs like the Carnegie sign. So what happens in Carnegie sign is resistance to the leg extension when lying with hip flexion. So you ask the individual to lie down and fold their legs at the knees. Now when they are sorry, not at the knees, at the hip, and when you try to raise their leg, you are going to from the hip, you are going to have resistance. Okay, you cannot easily lift the leg from the hip. So that is Carnegie sign. The next is Brudzinski sign, when there is neck flexion, and like if you try to flex the knee, there will be a flexion of the hip and the knee joint also. Okay, I can show you in the class about some by demonstrating it on somebody, but that is how the two signs with the meningitis are the Carnegie sign and the Brudzinski sign. Okay, the other complaints can be of vomiting and irritability or lethargy, which can lead to stupor or seizures. The complications are hydrocephalus, where there is which has developed because of the blockage of the CSF outflow. Then there can be a fulminant condition which can develop, which can lead to a development of DIC, that is disseminated intravascular coagulopathy. So because the brain is infected, everywhere else the antibodies are getting released, and as the antibodies are getting released into the systemic circulation, the body will stop fighting, and a DIC is that there will be clots everywhere in the body. Okay, so those are really deadly complications of the meningitis. What are the diagnostic tests to check if the individual has meningitis? Is you have to examine the CSF. Without examining the CSF, meningitis cannot be labeled. Okay, as soon as you see the CSF, you do the sugar and the protein test, and you do the culture, and you can recognize the organism. Meningitis is labeled. Treatment is antimicrobial therapy depending on which organism is infected. Steroids are given to reduce the inflammation and edema, and preventive measures is generally so that the babies do not develop meningitis. We give vaccines. Vaccines are given for that purpose. Okay. Now, brain abscess. What is brain abscess? It is a localized infection. When the brain is infected by an organism and the infection is localized to a definite area, it can be either in the frontal or the temporal lobe. You can see a necrosis of the brain tissue, and that area is dying, and that area around the dying area is having edema. The common organisms leading to such conditions are staphylococci, streptococci, pneumococci. They are all the round coccus which are most common organisms. Generally, the brain abscess has an insidious, very slow onset. You can see the focal signs depending, like if there is in the frontal area, if it's in the temporal area, the smell is affected. Frontal area, there is personality change, something like that you can see. And treatment is generally surgical drainage and antimicrobial therapy. Okay, you have to drain the abscess, and you have to give the antibiotics to fight against the bacterial infection. The encephalitis is the infection of parenchyma or connective tissue in brain and spinal cord. So it is meningitis was only affecting the meninges, right? Encephalitis means the infection is on the parenchyma, on the brain tissue, okay, and the spinal cord tissue. There can be due to viral infection, which can result in a permanent damage because the brain is affected, right? The neurons are getting affected, and once they start dying, it can leave a permanent damage. Examples are Western equine encephalitis, which is caused by the mosquitoes seen in some children in summer. There is St. Louis encephalitis, which is seen in older person, and it is more serious than the younger ones. There is a West Nile fever, again caused by a flavivirus, which is spread by the mosquitoes. The individual will present with flu-like symptoms, low-grade fever, headache, confusion, and tremors, and that will lead to a more generalized infective condition of the brain. So, whenever a person presents with fever, no physician takes it lightly, right? They always ask you a travel history. If you have gone to an area which is infested with mosquitoes, you are going to have all the blood tests, and you are going to have all the tests to check that you do not develop encephalitis, right? Because of this reason, because mosquitoes can cause so many of the viral infections, so many of the fever infections which can affect the brain also. The next we are discussing is a Lyme disease, which is caused by the spirochete Borrelia burgdorferi. That's a tick bite in the summertime. Remember that when we go for walks in the garden in the summertime, there are strict tick warnings. Why? Because a tick bite can cause this Borrelia burgdorferi infection, which can cause a Lyme disease, and the lesions which will appear on the skin is look like a bullseye. So there will be a red dot surrounded by a red circle, bullseye lesion. Okay. The treatment is a prolonged antimicrobial therapy is generally prescribed. Why? Because the brain is affected, and you need to protect the brain against the organism, so a very long antibiotic therapy is given. Herpes simplex encephalitis HSV1 is a trigeminal nerve virus, and they can also cause encephalitis, and the drug given over in this case is an antiviral drug because this is a virus. What are the other infections? The rabies. Remember, rabies caused by a bite of infected animals. There can be immediate treatment. You have to, if whenever you're bitten by an animal, the first thing you do is wash the wound, because the rabies virus particles might just be only on the surface. It might not have entered your blood circulation. So your first of thing that you do is wash it off, wash the wound off very clearly. Immunization